the small intestine channel. We begin the small intestine channel with small intestine 1. Small intestine 1 is the yin well and metal point of the small intestine channel. It is located on the dorsal aspect of the little finger at the junction of lines drawn along the ulnar border of the nail and the base of the nail, approximately 0.1 sun from the corner of the nail. This is small intestine 1. Small intestine 2. Small intestine 2 is the yin spring and water point of the small intestine channel. It is located on the ulnar border of the little finger in a depression just distal to the metacarpophalangeal joint. This is small intestine 2. Small intestine 3. Small intestine 3 is the shoestream and wood point of the small intestine channel. It is the confluent point of the governing vessel. It is located on the ulnar border of the hand in the substantial depression proximal to the head of the fifth metacarpal bone. This point is easier to locate when the hand is made into a loose fist. Needle with the hand in a loose fist position with the metacarpal bones lying in the same plane. This is especially important when needling deeply towards the opposite side of the hand. This is small intestine 3. Small intestine 4. Small intestine 4 is the one source point of the small intestine channel. It is located on the ulnar border of the hand in the depression between the base of the fifth metacarpal bone and the triquetral bone. This is small intestine 4. Small intestine 5. Small intestine 5 is the yin river and fire point of the small intestine channel. It is located at the ulnar border of the wrist in the depression between the head of the ulna and the triquetral bone. Most sources locate this point between the styloid process of the ulna and the triquetral bone, but in practice the styloid process of the ulna may not be palpable, and when it is palpable it often lies slightly posterior to small intestine 5. This is small intestine 5. Small intestine 6. Small intestine 6 is the C-cleft point of the small intestine channel. It is located when the palm is placed on the chest. This point is on the dorsal aspect of the head of the ulna in a cleft level with and to the radial side of the high point of the styloid process of the ulna. This point may be located in the following way. Ask the patients to lie with their arm by their side and the hand prone, palm on the couch. If the practitioner places a finger on the high point of the ulna styloid and asks the patients to place their palm on their chest, the point is found in the cleft where the practitioner's finger then rests. This is small intestine 6. Small intestine 9. Small intestine 9 is located on the posterior aspect of the shoulder, one sun superior to the posterior axillary crease when the arm hangs in the adducted position. This point lies in the depression just below the posterior border of the deltoid. This is small intestine 9. Small intestine 10. Small intestine 10 is the meeting point of the small intestine and bladder channels with the young linking and young motility vessels. It is located on the posterior aspect of the shoulder in the depression inferior to the scapular spine, directly superior to the posterior axillary crease when the arm hangs in the adducted position. Slide a finger directly upwards from small intestine 9 until it falls into the depression just below the scapular spine. This is small intestine 10. Small intestine 11. Small intestine 11 is located on the scapula in a tender depression 1/3 of the distance from the midpoint of the inferior border of the scapular spine to the inferior angle of the scapula. In practice, it may be difficult to palpate the inferior angle of the scapula. An alternative method of location is to draw an equilateral triangle with small intestine 9 and 10, after first ensuring that the patient's shoulder is relaxed. This is small intestine 11. Small intestine 12. Small intestine 12 is the meeting point of the small intestine, large intestine, sanjiao, and gallbladder channels. It is located in the center of the suprascapular fossa, directly above small intestine 11, in a depression formed when the arm is raised. Caution: deep perpendicular insertion, especially in thin patients, carries a substantial risk of inducing a pneumothorax. This is small intestine 12. Small intestine 13. Small intestine 13 is located in the tender depression superior to the medial end of the scapular spine, midway between small intestine 10 and the spinous process of T2. Slide a fingertip medially along the superior border of the scapular spine until it falls into the tender depression just lateral to the medial border of the scapula. Caution: this point is located close to the medial border of the scapula. Too medial an insertion or deep medial oblique needling may puncture the lungs. This is small intestine 13. Small intestine 17. Small intestine 17 is the point of the window of heaven. It is located in the depression between the angle of the mandible and the anterior border of the sternocleidomastoid muscle. Palpation of the anterior border of the sternocleidomastoid muscle is made easier if the patient turns their head away from the side to be needled, whilst you apply resistance at the chin. If the transverse process of C2 is palpable, locate and needle this point anterior to it. This is small intestine 17. Small intestine 18. Small intestine 18 is the meeting point of the small intestine and sanjiao channels. It is located directly below the outer canthus in the depression at the lower border of the zygomatic bone. This is small intestine 18. Finally, small intestine 19. Small intestine 19 is the meeting point of the small intestine, sanjiao, and gallbladder channels. With the mouth open, this point is located in the depression between the middle of the tragus and the condyloid process of the mandible. In order to locate this point, ask the patient to open the mouth so that the condyloid process of the mandible slides forwards to reveal the depression. Needle with the mouth open. Following insertion of the needle, the patient may close their mouth. This is small intestine 19.